Sometimes we take life so soft and we actually forget that any slight mistake you make with your life will lead you into a more big and expensive uh, problem. If you're a mother out there or a father, look at your child and you'll ask yourself, will ask you, are you happy with the way they are in, just in case they have any disability or any developmental disorder? And will you ever forgive yourself for treating this child carelessly? Just think about it. As you carry this child to the hospitals and do all sorts of stuff, how do you feel inside you when you had a chance to save this child's life and you didn't? So let us not take things for granted. Let us do what we are supposed to do. But of course, I welcome you to this show. This is Health Pot. This program is brought to you by Makerere University School of Public Health, together with Family TV. Adrian Austin Mukalas is my name. And Mebo Murungi, our sign language interpreter. Like we promised you last Friday, that we shall bring Dr. Angelina back. Here she is. Doctor, once again, greet our esteemed viewers.
Viewers of Family TV, I want to welcome you to this show, and I hope you are all ready to listen to this problem or this condition that we are going to talk about. Thank you very much for viewing.
Well, thank you so much, Doctor. Like we introduced the aspect of developmental disabilities last week. You who missed last week's episode, you can check for it on our YouTube channel, that is Family TV Uganda, or you can as well download our Family TV app so that you do not miss any of these episodes. Because I know some of us live far and some of us our roads are so busy that by 7 you're still in jam. But you can as well download the Family TV app and watch on your phone. And of course, due to public demand, this program will now be repeated on Wednesday at exactly 8:30 a.m. Therefore, just in case you want your friend, your neighbor, your mother-in-law, anybody to watch this program, please tell them that just in case they miss today, they shouldn't miss Wednesday at exactly 8:30 a.m. So, Doctor, I want us to talk about cerebral palsy like we promised our viewers last time. How can you define cerebral palsy? Because very many people have children who are victims of this disorder, but they don't know that it is actually cerebral palsy. What is cerebral palsy?
Now, cerebral palsy is a medical term that is used to describe children who have a condition. It's a neurological condition, which is a condition of a disorder, we can say a problem with posture and movement. When I talk about posture, what do I mean? How this child is able to sit, how this child is able to walk, how this child is able to stand. That is posture. And then movement, how the child is able to coordinate their limbs and things like that. Now, this disorder of posture and movement is as a result of damage that happened to this child's brain when this brain was developing, in the time when the baby was in the mother's womb, and also can also occur within the first 2 years of the child's life. So you find that this problem of cerebral palsy does not only mean a motor problem, but also you find these children have problems with vision, some may have problems with hearing, some may have epilepsy, some may have problems with sensation, the way that they feel, and such conditions. So you find they have that motor disability of cerebral palsy as well as other conditions.
So should we conclude that cerebral palsy is not limited to movement and posture?
It is actually a mixture. It's a combination of conditions, but mainly motor, with or without some of these other things. Because you may find some children who have this motor problem and they're not able to speak. Others have this motor problem, they're not able to see, they're not able to hear. So it is like an umbrella term, having all these conditions.
So you've said that these are children who have challenges in posture and movement.
Yeah.
Should we say that these are the kind of children we see that cannot walk, that always in carriers? You find a child, they tell you this child is 10 years old, but they're still in a carrier, a baby carrier.
No, these children with cerebral palsy are of different types because we have different levels or different levels of severity. And there are certain ways that we can group them from number 1 up to 5. So you may find that your child has a problem with posture and movement, but is still able to walk, but cannot use maybe the left arm, the right arm, and the left leg. Some of them are having all the limbs affected. Some have only one limb affected. So it depends. It's not always that you have to be carried in a carrier. You may have cerebral palsy, but you have just one side of the body paralyzed. Others may have it when they're having all the 4 limbs affected. Others may have it when they have only one limb, maybe only the hand or only the leg affected. So those whom you see in wheelchairs, those are severe because they're having all their limbs affected, the limbs, upper hand, and also the legs, so that they need the wheelchair to help them move from one place to another.
You talked about the 5 stages. What are these 5 stages?
Now, the 5 stages are for us as medical workers to be able to determine. We have a certain classification system where we determine, is this child at level 1, level 2, level 3, level 4. Now, those levels are for us to know and say if this child is, for example, the severe ones, 4 and 5, which means they need to be put on wheelchairs, they need to be wheeled by somebody, they're not able to have independent living. They need to have someone to help them in activities of daily life, dressing, eating, and things like that. When you're level 2, level 3, you have some problem, but it's not that much. You're able to do certain activities, but other activities, for example, you cannot run very fast. You cannot be able to do certain things at the speed that other normal children can do. When you're at level 1, you are very mild. Someone, unless someone is experienced, may actually miss you. You may have just a mild problem with your hand, but you're able to do other normal things like other children. So this severity is for us as the medical fraternity to be able to determine how do we manage you? How do we take care of you in that sort of sense? Yeah.
So, Doctor, according to research, how common is this problem in Uganda?
This problem is quite, I can say it is quite common compared, for example, to the high-income countries. We carried out research in a place called Mayuge, which is in eastern Uganda. And we looked at the population of children there from the ages of 2 to 17. And we found out that 3 in every 1,000 children have this problem. Compared, for example, to high-income countries like Europe, where you find 1.5 to 2 have this problem. Meaning that children here in a country like ours, low-income country, this problem is quite frequent. Yeah.
Okay. So, what are some of the risk factors of this?
Well, the risk factors that we have seen many times occur around the time of birth. Some people, even their colleagues of ours here within this department, in this School of Public Health, who have carried out research and have found out that the time around the time of birth is a very, very problematic area. We have what we call birth asphyxia. Children are born when they are having problems with breathing or the problem of oxygenation. As I mentioned in my previous session when we were talking about developmental disabilities, as the baby is being born, going through the birth canal, finds resistance, and the blood supply to the brain is somewhat tampered with, that child has a problem. Many times you find that even mothers can have prolonged labor for whatever reason. Either the mother has a narrow pelvis, or around the time when the process of labor is supposed to proceed, there's very poor progress. Some children are born when, for example, the mother may have the rupture of the bag, the sac which has the fluid where the baby is, but thereafter there's no progress in labor. Sometimes the mother may have infections occurring around that time of birth, and these infections go to the brain, affect the brain, and result in that. In our study, we realized something which was very interesting, or very strange, in that many children who were born normally, the children were born very normal, the mother left hospital, everything was okay. During the first 1 year of life, 1 to 2 years of life, developed malaria. This malaria went up to their brain and they got what we call cerebral malaria. Many of these children who were actually born normal, but during these first 2 years of their life, got either cerebral malaria or meningitis, developed this condition. So it is not for you to say, for me, my baby was born normally, it is okay. Something can happen during those first 2 years, which can be a problem. So you have to be careful and ensure that you treat your children as quickly as possible.
Dr. Angelina, I beg that we go for a short commercial break, and then when we come back, we continue, because this is a very serious topic that no one should miss out there.
Okay.
As you think about the Lord just taking over your case and you are no longer in the midst of it, and he says, fear not.
Demons from the mountains, scream and leave.
In the name of the
Demons
Lord.
from the graves, scream and leave in the name of Jesus.
Welcome back from that commercial break. This is Health Port. Remember, this program is basically looking at maternal health and early childhood development. You realize that the way you handle your child when they're in their tender stage will determine what they will be. Like doctor is telling us, that you can never say my child is safe, because even after safe birth, your child can still develop what we call cerebral palsy. So doctor, you are still telling us that people who are most at risk.
Yes.
We had looked at some of the categories, and you had told us about these children who develop meningitis and cerebral malaria.
Yes.
What about these children? There is a friend of mine who I know. He said he was walking like any other normal person up to the age of 8 years. And then from 8 years, he developed some slight sickness. Then 1-2 days, his legs became crippled.
Yes.
Could that be also part of cerebral palsy?
No. Cerebral palsy, as I mentioned, is a disorder of posture and movement that occurs during the time of early brain development. Now, this friend of yours at the age of 8, the brain, yes, most of the brain development has occurred. It's still growing, but at a very minimal rate compared to the first 2 years of life. So what your friend developed is what we call acquired brain injury. This acquired brain injury must have resulted from whatever made him sick. Now, whatever made him sick could have been an infection. We don't know. He might even, I don't know whether it was both limbs that got affected or one limb? One limb. Now, if it is one limb, you start suspecting things like poliomyelitis. Polio can affect you and you are affected with one limb and you're not able to use that limb. It could have been some other injury, I don't know, but it needs to have an assessment. But we can't say that that person has cerebral palsy. He does not fit into our definition. That person may have gotten some infection which affected the brain and then led to that limb being affected. And something like polio can happen in such a case. But it will need to have further checking to find out what the possible problem could be.
So, Dr. Angelina, we realize that actually very many mothers are struggling with children. But like I asked you last time, at what age should a mother now say my child might be safe from cerebral palsy? Because you've told us that it can even occur at the age of 2.
Okay, usually we say within the first 2 years of life, if a child gets any injury to the brain, and then this injury results in this disorder of posture and movement, then we'll classify that child as having cerebral palsy. But remember that the brain can be injured at any time, even with us. But we're not going to say that because I've been injured, God forbid, I've gotten cerebral palsy. No. No child is safe. Let me say that. You can be affected, but we may not classify you as having cerebral palsy. We'll classify you as having had that injury to your brain, resulting in a motor problem. So it's always important that when you suspect your child to have any illness, seek medical attention as soon as possible so that you can prevent any complications.
That then takes me to this question. Now, when a mother realizes, or the family, mother, father, because this is now collective effort, the father has to play his role, and the mother has to play her role. So when they realize that now our child is suffering from cerebral palsy, what do they need to do to care for this child?
It is always important that we have the family involved. Many times in my practice, I see it is the mother who comes, because these mothers tend to be rejected. They'll say, you go with your child.
Some fathers run away from
Exactly. Families break up because of these children. And I've also seen the good side, where you find a father so concerned bringing this child and saying, the mother ran away. So it can go either way. The mother can run away, the father can run away. But what we want is for the family to come together and say, yes, this is a blessing for us. We have this child. What can we do? There is always help for such children. It's important that you go and seek medical advice. Then depending on what the child has, they're going to assess this child. Yes, the child has cerebral palsy. But in addition to cerebral palsy, what does the child have? The child may have epilepsy. They can give the child treatment to reduce on the frequency of getting those seizures. The child has a problem with vision. They take the child to the eye doctor. They see, can this child wear glasses? And they give the child glasses. The child has a problem with hearing. Can the child go and they have a hearing aid? Or can this child be taught sign language? So it is not for you to say it is a death sentence. My child has cerebral palsy, close of chapter, that's it. No. There is a lot that this child can.
Some parents call them good for nothing.
No, that is a mistake. In fact, they should seek forgiveness from God. These children are blessings. You have to tap the potential of your child. You have to understand what is it that this child can do and then build on that. Some of these children have problems even with settling down. They keep on moving, but you find that their brain is active, very, very active. They can be taken to school and they study. So it is not for us to give up and say nothing can be done. What I want to also tell parents is the stigma. Some people are so frightened about such children because they say the saliva from these children is contagious. The saliva from these children should not touch them. So getting maids is a problem because the maids say, I don't want to deal in such a child. Then even neighbors fear them and say, don't go to that house because they have a child who has saliva coming out.
And they're not even accepted in some schools.
They're not accepted in schools, but this is wrong. These children have a challenge and they need to be understood, and we need to take care of them, love them, and take care of them as best as we can. So the community out there, these children with cerebral palsy is an illness like any other illness. Welcome them, understand them, and there is no way that that saliva is going to affect you. Love these children, show them care, and try to see how you can develop them. Help them in whatever defects that they have, and improve their lives for their betterment.
Wow, thank you so much, Doctor.
Yeah, you're welcome.
Yeah, we are indeed grateful for today's topic. And I believe a mother out there who has been cursing yourself for having gotten married to that man so that you give birth to such a child, you have now consoled yourself, you have now gotten a peace of mind, you have now strengthened yourself. This is not a curse, but this child is a blessing. And treat her or treat him the way you will treat the rest of your children. And God will bless you. God will surely bless you because this child is not a curse, but a blessing from God. Therefore, thank you so much for watching today's program. This is Health Pot. Remember, this program is brought to you by Makerere University School of Public Health and together with Family TV. Edwin Austin Mukalas is my name. Dr. Angelina has taken us through cerebral palsy, and Mebo Mrungi, our sign language interpreter. Jonah Jal, the producer, Tony Santo on social media, and Bantam in transmission. But of course, Brenda, also our coordinator. You who see us today, you see us because Brenda did her work. Thank you so much, and endeavor to watch the repeat of this program on Wednesday at exactly 8:30 a.m. Therefore, inform all your friends, your loved ones, your everyone to watch this program because we all need it. Good night and enjoy your weekend.